All right, let's continue with this now. Transport Minister Sindisiwe Chikunga says government is deeply concerned about the ongoing taxi violence in the Western Cape. Chikunga has blamed the city of Cape Town for exacerbating the already volatile situation by continuing to illegally impound hundreds of taxis without applying the country's public and land transportation laws.
We met with the city yesterday. I must commend the Premier of the Western Cape. I must also commend the MEC responsible for transport in the Western Cape, MEC Mackenzie. But the city is so arrogant. They decided that they're not going to participate in the negotiations. They decided that they've actually issued the conditions and they're not budging. And those conditions, they actually include these things that are not in the NLTA, but that are in the NRTA. And those, they do not, as a matter of fact, have a sanction of what is this, impounding the car. That is the problem that we have. However, late in the evening, somehow they indicated that they were going to subject these to their legal people. We already are doing it as the Department of Transport to subject this. We have advised the Western Cape province to say they must actually set aside these conditions so that it is only the national act that gets implemented and applied in the Western Cape, at least for now, so that the taxi industry can call off the strike. Because whatever the mayhem that is happening there, we believe that once the taxi industry goes back to operations, then of course the mayhem can actually be reduced. We are concerned about the number of people that are not able to go to work, the children that are, learners that are not able to go to school, and the frustration that is happening there. But we're also concerned about the picture that is created about us in the international arena, particularly because this actually happens at the time when we are hosting the Netball World Cup. So these are the issues. Those are the two legislations that are being, we believe, implemented and executed wrongly. There are conditions. They are there in the National Land Transport Act. Impound on those. The taxi industry was actually calling on me to declare a moratorium on the impoundment of cars, and I said I can't, because there is a legislation. I don't have powers to declare any moratorium on any legislation. So I can't do that. So the conditions that lead to empowerment in terms of the National Land Transport Act, they remain in force. But the conditions that are being added as sanctions that are not in the legislation in the Western Cape do not have any legal standing. They don't.
Now let's get an update on the strike. SABC News reporter Atule Joka joins us now. Atule, thank you so much for your time. Of course, we know that the Minister of Transport, as we've seen, is in the Western Cape and she's not happy with city officials. Just talk to us about the current situation now and other services. Have they been affected?
The situation is not the same as yesterday. It's not as volatile, but there's been some incident of sporadic incidents such as stone throwing that have been reported. It also remains unsafe. It still remains risky. We understand a lot of emergency services vehicles had to be escorted to places where they are going to offer medical assistance, because it still remains quite dangerous to go into those areas. As Santaco, the Western Cape provincial government and national government are not able to find that amicable solution as yet. I was driving through in town and I realized that most businesses are still not operating to their full capacity. Most franchises are closed down. In some shops, you can feel the sound of some foul smelling in there, as most of the labor force are unable to travel to work due to the intimidation and threats that are happening and the slow of traffic that is coming through to town. One of the sectors which has been greatly affected is the sector of the health department. I will bring in the MEC, or the Minister of Health in the Western Cape province, Minister Nomafrench Mbombo, to talk to us about the impact of the strike, particularly in the health sector. Please just give us a picture.
Today, things are far much better than compared to yesterday. For example, yesterday I was in Tygerberg Hospital, the second biggest hospital in South Africa, the biggest one in the Western Cape, where especially in the trauma it was affected. At the time that I was there in the morning, almost about 120 nurses were unable to come to work, plus also other staff in the kitchen, but things were running smoothly. I need to commend the staff for, although that their circumstances were not as good, because there were patients also, we have to manage them in the corridor, because in some of the facilities like Mitchell's Plain Hospital, they were unable to do some of the emergency operations. So whilst I'm saying things are better, but you must understand that some of the services operational, they are not fully functional. Still, we have to postpone the elective surgeries. Also, one of the other things this morning, Kaelicha Saitsi, Nolungile, they banned it, so parts of the clinic, including the youth clinic that is under the city, it's not sorry, it's no longer functional. And also, it's not only in the metro, in the areas in Garden Route, the Mossel Bay, the Neisner, there have been some disturbance. But what I could just indicate is that at the end, especially in the case of when they're banning the clinics, the most people who end up suffering are the poorest, are the ones who are vulnerable. So that's why we appeal for the safe passage for the health workers. Actually, Atule, on day one, on Thursday when it started, they banned an ambulance. Can you imagine? Because it is branded, one can be able to see a young female staff member was driving it, had to jump and run, and yet people could see that it's an ambulance. So the whole of the criminality, the hooliganism that is happening, it does have a huge impact because staff are unable to come to services. In Tygerberg, we also made a plan B because when I was there, some other staff from night duty where they were unable to go back to their homes. So we have to use some of the nurses' home, old nurses' home, to be able for some of the staff at least to be able to sleep, because as things were, it was very hectic. But I'm glad that things are getting there. But lastly, here in the metro, like now we are behind, this is a city clinic, Table View. Although things are quiet, but some of the clinics under the city have been closed. Actually, even ours, some of them in Guguletu, in the Nyanga, in Philippi, in those volatile areas where there are lots of stone throwing to the passers-by and also to the motor vehicles, it does have a huge impact on the staff.
And also, maybe your sector is quite a sensitive one because it deals with people who are sick.
24 hours.
Yeah. So just talk to us about the impact this put, especially on the patients. We understand some people have to take their medication. You just told us that you had to postpone some of the surgical operations as well.
It's a lot because when, for example, the Mitchell's Plain Community Health Center is at 24 hours. The Guguletu Community Health Center is at 24 hours. And it also takes, taking also the emergency, for example. Now, when you have a situation when there's an emergency, but the nearest clinic or health facility where you can go to, it's closed. Therefore, it means that now the ambulance, which might delay even to come, especially in the red zoned areas, have to take you all the way to Tygerberg Hospital. As I'm saying that a 60-bed ward trauma emergency in the Tygerberg, there are about 80-something patients. And some of the staff were unable to come, like in the case of high care, where people are also on ventilators, where now we find that one nurse has to look after 5 ventilators. And that also because of these kind of situations where there's no access to emergency, as I'm saying that some of the patients actually have to manage them on the corridor. Hence, we appeal for as many. Luckily, some of the nursing students, like the University of Stellenbosch, 4th-year students, they were able to come, and also we got some volunteers from the home-based carers who came. But the situation for the ambulance, because mostly there are 2 in the car, going to a place where it's high volatile area, it means that they need to be escorted by the police. But noting the police, they are also needed. in some of the areas where there's a high level of the crime, meaning now you have to take a police van to escort an ambulance that has to fetch someone who's ill. And the reason for that has to be escorted is because the same people, that community that are calling the ambulance, are the ones that they need it most. But now they have to take the whole of those resources. So that's why we appeal safe passage for healthcare workers. Because at the end, whether you are a taxi driver, whether you are a government official, whether you are a criminal, at the end you still need us.